Good afternoon and welcome to MBA Health Group's webinar mini-series on the meaningful use requirements. My name is Cody Simpson and I'll be presenting a lot of great meaningful use information to you over the coming weeks. I know your time is limited, so I want to jump right in. As many of you know, meaningful use requirements include both a core set and a menu set of objectives that are specific to eligible professionals or eligible hospitals. We are focused in this webinar on the eligible professionals in an ambulatory setting. To positively attest to Stage 1 of meaningful use, eligible professionals are required to meet 20 of the 25 specified objectives. 15 are core measures required for all providers, and the remaining 5 measures can be chosen from the list of 10 menu set objectives. These objectives must be met over a continuous 90-day period within the calendar year. This webinar series will focus specifically on the core measures each provider is required to report on. This slide shows a list of all 15 core measures required for meaningful use. I want to note that core measure number 10 is the requirement to report clinical quality measures. Providers must report on 6 total clinical quality measures, 3 required core measures, substituting alternate core measures where necessary, and 3 additional measures from a set of 38 measures. We will touch on these briefly when we come to them in the series, but I wanted to point out how they fit into the requirements. Today's webinar will focus on the first 2 measures, CPOE for medication orders and implementing drug-drug and drug allergy interaction checks. There will be time for questions and answers following the presentation, so feel free to type your question at any time. Meaningful use core measure number 1 is CPOE for medication orders. The objective of this measure is to have providers enter all of their medication orders into the EHR. To meet this measure, more than 30% of all patients seen by the provider with at least one medication in their med list must have one medication order entered using CPOE. There are 2 terms to define within this measure: CPOE and unique patient. CPOE is the abbreviation for computerized provider order entry, which entails the provider's use of computer assistance to directly enter medication orders from a computer or mobile device. This means the order is captured in a digital and structured format into the EHR. The concept of unique patient means that if a patient is seen by a provider more than once during the reporting period, then the patient is only counted once in the denominator. The attestation requirements of this measure include a numerator and a denominator. The numerator of this measure is the number of patients in the denominator who have at least one medication order entered using CPOE, and the denominator is the number of unique patients seen by the provider during the reporting period. The resulting percentage must be greater than 30% to meet this measure. A provider may be excluded from this measure if fewer than 100 prescriptions are written during the reporting period. This measure could present a unique situation in which a provider would be unable to successfully attest and could have the potential to utilize a modified denominator. Typically, this is true for specialty providers. There are 3 criteria a provider must meet in order to use the alternative denominator, and they are prescribing more than 100 medications during the reporting period, maintaining medication lists that include medications that they did not order, and ordering medications for less than 30% of patients with a medication in their medication list during the reporting period. In the unique situation where all 3 criteria mentioned apply, a provider may limit their denominator to only those patients for whom the provider has previously ordered medication, if they so choose. Providers who do not meet the 3 criteria must still base their calculation on the number of unique patients with at least one medication in their medication list seen by the provider during the reporting period, regardless of who ordered the medication or medications in the patient's medication list. I will now demonstrate how you could achieve this measure using Enterprise EHR. So let me switch over to my test system here. On your screen, you can see the clinical desktop where you can access the Medications tab in the lower left-hand portion of the screen. From this tab, depending on your specific configuration, you can order, edit, renew, or even reconcile medications. You can also access the Medications tab in the Add Clinical Items screen from the Clinical toolbar, as you see here. Consistent entry of medications into the medication list using Enterprise EHR will ensure the measure is met for every patient. Okay, there are two workflow considerations to be discussed within your practice with respect to this specific measure. First, the medication list for all patients should be managed on a consistent basis and all information recorded even if a paper script is used. Second, just a reminder, medications flagged as record without ordering will not count toward the numerator of this measure. Before we move on to the next measure, I want to highlight what your meaningful use status report will look like if you haven't seen one already. The report contains a list of all meaningful use measures, including the goal for that particular measure and your score. This report is generated by the Stimulus Reporting Portal, which is updated each night based on the changes you make in the EHR. The Stimulus Reporting Portal is only accessible once you implement the stimulus set. If you would like more information about stimulus set implementation, please let us know. Meaningful use core measure number 2 is drug interaction checks. The objective of this measure is for the provider to implement drug-drug and drug allergy interaction checks. To meet this measure, automatic checking capability must be implemented within the EHR. The attestation requirement is that the provider must attest yes to having enabled the interaction checks for the entire length of the reporting period. When you have this enabled in the EHR, which I'm sure almost all of you do, then you are able to attest yes to this measure. In Enterprise EHR, when drug-drug and drug allergy checking is enabled, the provider will be prompted with an alert similar to what you see on the screen when an interaction concern is present. Again, this does not require any additional effort on your end if the interactions are enabled in your system. There is one key workflow consideration to note within your practice with respect to this measure. When the provider is prompted that a drug-drug or drug allergy interaction is present for the current patient, the provider can choose to deselect the medication or override the prompt by selecting from several different options you can see here. It is important to decide how providers will proceed in these situations as to ensure continuity in your practice. So I want to thank you so much for your attendance and participation on today's webinar. Our next webinar will be held on Thursday, January 26th from 12:10 to 12:20, or you can join us for the same session from 3:10 to 3:20 that afternoon. We will be covering core measures 3 and 4, maintaining the problem list, and e-prescribing. You will be receiving an evaluation of this webinar over email. Please take the time to provide feedback as we will use it to develop future content. A recording of today's presentation will be posted on our website, and please do not hesitate to contact us with any questions you may have. Since we're just about at 10 minutes, I would be happy to stay on and answer questions from the audience for the next 5 minutes or so. So please stay on the line if you have questions, and if you need to go, thanks for joining us, and we hope to see you next week. I don't see any questions, so I want to thank everyone for joining us, and this concludes this webinar.